Assalamu alaikum. Today we are going to discuss about some MCQs from hematology. So the first MCQs is what is the desired concentration of EDTA in the blood for best result? So the desired concentration is about 1.8 milligram per del. Ethylene diamine tetraacetic acid is a chemical used in the blood to prevent the coagulation of blood in the lab test. When we collect blood, we use EDTA to prevent the coagulation. It has anticoagulant properties. During acute inflammation, which cells will provide predominant response? So the answer is neutrophil, because neutrophil are the first responder reach to the inflammatory site during acute inflammation. What is the normal pH of the blood? So the normal pH of the blood is in the range of 7.35 to 7.45. It is a little bit alkaline. Fibrin with entrapped RBC comprise a clot, because fibrin when combined with the platelet and RBC, it can result in the clot formation. Leukemic blasts contain prominent granules called multiple or rod. So we know that in acute leukemia there are multiple granules or rods seen in the immature blast cell called the or rod. So the answer is acute leukemia. JQ mutation is seen in. So here is the answer is polycythemia vera, because we know that polycythemia vera is a myeloproliferative disorder characterized by overproduction of RBC in which there is JQ mutation found. Which of the following statement best define hemophilia? So we know that hemophilia is an X-linked recessive disorder common in male characterized by factor VIII deficiency result in bleeding. So this is a X-linked disorder commonly affecting male. The option 2 is the correct answer. Which of the following is a bone marrow disorder that result in overproduction of WBC? So we know that polycythemia vera is a blood disorder. Hemochromatosis is also a blood disorder in which there is a excessive production of iron. Thalassemia is a blood disorder, while the myelodysplastic syndrome is a bone marrow disorder characterized by overproduction of RBC. So the correct answer is myelodysplastic syndrome. Which blood cell lack a nucleus? So we all know that red blood cell has no nucleus, and due to which its shape is bioconcave. And we know that the immature form of the RBC called the erythrocyte has nucleus, while the mature form has no nucleus. What is the term for the process by which the white blood cell move through the blood vessel wall to reach the infected tissue? So we all know that at the site of inflammation, interferon and tumor necrosis factor release, and they attract the white blood cell like macrophages towards the site of the inflammation, and the process is called chemotaxis. So the answer is chemotaxis. In the presence of calcium, thromboplastin convert in active prothrombin into. So we know that prothrombin converted into the active thrombin, and this active thrombin then convert the inactive fibrinogen into fibrin, and fibrin combine with platelet and RBC and result in the formation of clot. A 60-year-old female present with blurred vision confusion petechia with a platelet count of 29 into 10 power 3 per microliter, PT 12 second, APTT 32 seconds. So we know that here the PT and the APTT are in the normal range, while the platelet are very less and deficient. The normal platelet are 29 into 10 power 9 per liter, while here is 29 into 10 power 3 per microliter. So this is a severe thrombocytopenia, and it is a syndrome. So the answer is thrombocytopenic purpura, in which PT and APTT will be normal, while this will characterize by blurred vision confusion and petechia. What is the primary function of the eosinophil in the immune system? We know that eosinophil defends against parasites. So the answer is defense against parasite. Which of the following is a blood disorder characterized by uncontrolled proliferation of white blood cell, especially in the marrow? So we know that polycythemia, hemophilia are blood disorders. Thrombocytosis is characterized by increased platelet count in the blood, and leukemia is a malignancy in the bone marrow characterized by overproduction of WBC as well as RBC. So the correct answer is leukemia, which is a cancer of marrow in which there is abnormal cell productions. EDTA typically preserves cellular morphology for about 2 to 3 hours. Which of the following is not a congenital red cell membrane defect? So here the thalassemia is basically a hemoglobin defect, while the spirocytosis, stomatocytosis, elliptocytosis, ovelocytosis, these are membrane defects. So the answer is thalassemia. Which one is important constituent of RBC? So we know that in RBC there is hemoglobin which combined with calcium and as a result can result in oxygenation of the body. What is the normal range for the hematocrit level in the adult female? So this is about the average range is about 35 to 45 percentage. Which clotting factor is deficient in individual with hemophilia A? So we know that hemophilia is a rare recessive X-linked disorder common in male in which there is deficiency of factor 8 and can result in bleeding. So in hemophilia B there will be deficiency of factor 9, while in hemophilia A there is deficiency of factor 8. The correct answer is factor 8. What are the precautions that have to be taken while using anticoagulant vials? Mix gently after adding blood. Add exact desired volume of blood. Do not push the blood through syringe. So all of the above are the correct answer. Thank you.